Hello everyone and welcome to another video with Code Rhetoric with Tam Talk. On today's video, I wanted to share some quick spinal surgical coding strategies that I have implemented when I am coding or dissecting a spinal surgical operative report. So hopefully these strategies will help bring some insight or some comfort in your journey as a spinal surgical coding professional. So let's get started. So with our first coding tip, we must first understand the anatomy of the spine. It is very important that you understand what you're coding. If you don't know the anatomy in which you're coding, it would be a challenge for you to actually code for that particular anatomy or procedures that are performed in that particular anatomy or body area. So with the spine, we're going to kind of go through some of the different components of the spine or spinal cord, excuse me. So the first is the cervical, then we have the thoracic, and then we have the lumbar, and then we have the pelvic. So this is pretty much, again, the anatomy of the spine. So when you see C or T or L or P with the number, they're referencing the specific component or area of the spine or spinal cord. Again, it is cervical, thoracic, lumbar, and pelvic. And as you can see from the image, it's showing you where those particular components are located. So again, cervical is closer to the neck area or is the neck area. The thoracic is more like your mid-back. The lumbar is your lower back, and the pelvic it goes down pretty much to your rectum or your anus. So yes, so again, the first tip is really understanding the anatomy of the spine. Now we'll proceed with the next tip. Tip number 2 is understanding the difference between the approach. Is it anterior or posterior? And for those of you who've been in coding, especially like orthopedic spinal coding, it is important to understand the approach or the approach in which the surgeon arrived to the anatomy for the surgical procedure. Was it anterior, which represents the front, or was it posterior, which represents the back? You will notice when you are coding for spinal surgical cases, there is an approach, and a lot of the code descriptors, especially like your surgical or CPT code descriptors, are based upon the approach. For example, if there was an anterior instrumentation or a posterior instrumentation. So again, the approach is very important when it comes to spinal surgical coding. So again, the anterior represents the front and the posterior represents the back. Let's move on to the next coding tip. So coding tip number 3 is define spinal orthodesis. And I actually should have listed this as understanding your medical terminology because, again, this also plays a very important part when you are coding for spinal surgical procedures. So we're going to go with what we have, again, is the spinal orthodesis. So the orthodesis is the fusion of the joint. And in the case of spinal surgery, it is the spinal orthodesis, or excuse me, the spinal fusion of the spinal joint. So again, when you see spinal orthodesis, they're actually referencing the fusion of the spinal joint. Okay, so again, orthodesis is the fusion or the putting together or fusing together of a joint. So orthodesis is the fusion of the joint. In this case of spinal surgical coding, spinal orthodesis is a fusion of the spinal joint. Tip number 4, pay attention to the add-on codes or the plus signs. So when you're doing spinal surgical coding, there are a lot of add-on codes. And for those of you who are new to coding, add-on codes are codes that are added on to the primary or the main procedural code. Add-on codes cannot stand alone, so you cannot just simply report an add-on code without the main or the primary code. So a couple of the examples that I use are the allografts. So the first one is CPT code or add-on code 20930, which represents the allograft, the morcellized or placement of the osteopromotive material for spinal surgery. And then we have 20931, which is also an add-on allograft structural for spine surgery only. So I took the liberty of highlighting as well as underlining the important elements of each code. Again, these both are add-on codes and they should not be reported separately or listed as the primary code. But if we look at, again, the underlined and highlighted code for 930, it is a morselized allograft, right? And again, or placement of an osteopromotive material for spinal surgery. So that lets me know that this code is specifically for spinal surgery, as well as it's the type of allograft, which is morselized, and that should be documented. And then the second one in 20931 is the allograft for structural, and again, it is for spinal surgery only. So again, both codes represent or specific to spinal surgery. With the 20931 allograft, it is a structural allograft. So again, these are key things that you need to look for when you're looking at your code selection or determining which codes to select. And it's going to be based on that documentation. So again, if the allograft was a morselized or an osteopromotive type of material such as BMP for spinal surgery, then that is your code. However, if the doctor or the surgeon documents that it was a structural allograft and it is being performed during a spinal surgery, then 20931 is your add-on code to add on. And again, these are add-on codes, again, plus signs. Again, there must be a main or primary code listed before these codes can be added. All right, tip number 5, know how to count the disc interspaces. Okay, so we see the C5 through C6, which represents the cervical disc for, I'm going to say C5 and C6. Then we have C6 through C7, and then S1 and S2. And so the dash, I'm going to say the dash represents the interspace between each disc, right? As you can see here, I'm pointing, but you can't see it, right? So C5 and C6 is one interspace. C6 through C7 is an additional interspace, and S1 and S2 is an additional interspace. So if the surgeon is working on these different interspaces, the total interspaces that the surgeon actually worked on is actually 3. So this counts as 3 interspaces. So again, it is important to know which interspace or disc interspace the surgeon is actually working on. So these are my quick tips for coding for spinal surgical operative reports. It is not exhaustive, but I just happened to be coding a case and I thought about, this may be beneficial to those who are practicing or who are attempting to study for orthopedic or spinal surgical coding. So these are some quick, easy tips to jot down, again, when you are coding for spinal surgical services. And if you are a student who is preparing to take your certification exam, it's okay to jot these tips down as well. It'll help make it easier for you to dissect the operative report as well as make your code selection. So if you have any further questions, if you would like to learn more about medical coding, please visit my website at www.abrahammedicalcodingcoachllc.com. Follow us on Instagram at Abraham Medical Coding, and email us at abrahammedicalcodingcoach@gmail.com. It's for business only, and our telephone number is listed as well, and all of this information is also listed on our website.